Somewhere between black and white, there is that shade of gray, and this is the gray area. I'm Mark Gray. Thanks for hanging out with us. And today we are joined by the man who is leading Howard University and the Mideastern Athletic Conference through these trying pandemic times. Dr. Wayne A.I. Frederick is not only a college president, he is a medical doctor, and he also is a former student athlete. So we are pleased, honored, and privileged to have the leader of Bison Nation. And I would never capitulate and play shamelessly to my guest, Dr. Frederick, but I'm just wondering, do you like the wardrobe?
I do. I love it. But I like I didn't see it, so I don't get you in trouble.
Yeah, that's right. We don't want my friends at Morgan to see me playing to you. But I was really struck by, your conversation with Chuck Todd recently on Meet the Press. And given that you are, in fact, a medical doctor by trade, and you look at the COVID-19 pandemic, what do you think the long-term effects of this crisis will be on the nation and ultimately the world?
Yeah, that's a great question. I mean, I think it's going to have a multitude of impacts. I mean, I have a 16-year-old son. My daughter's going to turn 14 in a few days. And one of the things that I try to talk to them about is, what has happened in history that has given us some insight into what we could expect. And 9/11 is one of those things. My kids were born after that time. And so when I tell them you could have walked your loved one to the plane practically and drop them off at the gate, they look at me like I have two heads, right? Because now they can't imagine that there's an airport that exists anywhere in the world where you don't go through metal detectors and you can't go to the gate unless you're flying. And so the same way we've adapted to that and moved on, I think is what is going to happen here. We are going to look at each other differently, hopefully in a positive way. Hopefully we're going to be more responsible for one another in terms of recognizing that if we get sick, we can infect others. We've been saying that for years with the flu, and people have been ignoring that and going to work ill and things of that nature. And I think those types of things are going to change. I also think how we approach inequities is going to look different, because the very people who were disproportionately impacted were the people who were serving our food, delivering our food, helping us out in the grocery stores. And we recognize that the interdependence that exists in the collective humanity of us all is unbelievable. And none of us are playing a role that's less important than the other. And so I'm optimistic that we'll get good things out of it. And I actually am especially optimistic about the young people, because I think when you see something like this at that early age, it impacts you for life, and it can impact you in a very positive way. And I think that's what we'll see.
Dr. Frederick, if the United States of America was a patient that you were diagnosing under your care, what would you tell them the condition that they're in right now?
Yeah, I would say critically ill. However, I would say that they have a very treatable disease, and they have to be compliant with the medications and the treatment that we prescribe. And right now, that treatment is social distancing. That treatment is not gathering in large numbers. That treatment is wearing masks when you're outside and around others. And that treatment is making sure that if you do not feel well, that you isolate yourself from others until you find out whether or not you can get tested. And then from, looking at the country as a patient, we have to improve our testing. There's no doubt about it. We are doing a better job, but we have to increase it even further, because we have to be aware of who has this awful virus and to make sure that we're isolating them. That's the only way. To take away the host from the virus is what ultimately will make the virus go away.
Howard University hospitals are literally on the front lines of the pandemic relief efforts. So can you explain, as an institution that's literally on the front lines of the pandemic relief effort, what you guys are doing specifically and the challenges that you're facing, most importantly, with regards to the well-chronicled dilemma that healthcare workers are facing as it relates to PPEs and protective gear that you need to simply do your jobs, that is saving lives?
Yeah, it's a good question. Very early on, the mayor made a petition to us to expand our capacity. And so we did that. We went ahead and expanded our capacity. We got quite a few extra beds. We were able to isolate the patients who have coronavirus to, several separate units in the hospital. Our healthcare workers were, first and foremost, they stepped up. So we also made sure that we could do things to help take care of them. We provided accommodations for those who are uncomfortable going home and potentially taking the virus back home to their loved ones. We had people volunteer and bring meals for them. That was very helpful. And then we started aggressive testing. We've now tested everybody who worked in the hospital. So we have a baseline of where they are, and we're going to continue a pretty aggressive testing program. When we look at, I think as we go forward, it has really been suppressed in DC. So the number of patients that we actually have in-house with coronavirus is very low. It's back to almost the same levels at the very beginning of the pandemic. But yesterday we had a spike in cases in DC, and I think we have to continue to be vigilant.
And at that lower spike based upon, I guess, American totals, talk about elected leadership and the role that they've played here in the nation's capital to get ahead of this thing, which has been one of the criticisms of the current presidential administration.
Yeah, Mayor Bowser has been phenomenal. She and her staff, and Dr. Nesbitt, the Department of Health Director, they've been, I think, fantastic. They've been open and transparent. I think putting out data has been very helpful. They've engaged the healthcare facilities. I think that has also been very much welcome, and they have followed the science. Their decisions have been based on the science and not based on, the economy and emotions. And I think that has been the key. And so we've been happy to partner with them as we do that. Now, as we get into the fall, it becomes a challenge because you have to look at what you're going to do at public schools and private schools in the district. And you have to look at what the universities are going to do. And university like Howard University has students who come from 44 different states. So some of those students are going to be in hotspots as well. And so we have to manage through that as well.
And I think you've got students from 71 nations at least too.
Yeah.
So how do you balance the treatment, the protocols, or what have you?
Yeah, what we're trying to do is to put health and safety first. I mean, there are immigration issues in terms of students being able to get visas. So we anticipate that a significant number of our international students may not be able to obtain the appropriate immigration status to actually physically come to the US, but could start their education online. We're going to stand up a lot of classes online. About 80% of our classes will be online. There are some classes that we will have face-to-face. And so we're going through a process now of surveying our students to see who has a desire to come to campus and to see who we can accommodate. And then based on that, we'll make a final decision as to how we proceed.
Dr. Wayne Frederick joins us. He is the president of Howard University. He's also the president of the Mideastern Athletic Conference Council of Presidents and a former student athlete at Howard University. So we now know officially there will be no HBCU sports at all in the fall. All four our conferences have chosen the tough, emotional decision to not compete. A myriad of things going on there, but what emotions do you feel right now about that? Not, divorce yourself from being the doctor for a second and from the perspective of a student athlete, a president that's made a significant investment in his athletic program, and those of us on the outside, no Howard homecoming, what are we going to do?
Yeah, my heart breaks. My heart breaks for the student athletes. I mean, college sports is such a joy because of the mix of maturation that you're going through in your own educational process and combining that with the competitive pursuit. I think it's one of the great places to be an athlete. And so to not be competing competitively is difficult. However, all of the presidents and chancellors of the MEAC have committed to make an effort to engage our athletes over this period of time in a productive manner so that they stay physically fit, that their mental health and their positivity about their prospects, going forward in terms of their careers, whether it be athletic career or in their chosen field of study, they get the maximum out of it. And so it is going to be challenging and different, but we're up for that challenge, and we're going to do the best job possible that we could do for them.
Speaking of challenges, you're facing another one, not only the pandemic on campus and all that goes with being a college president, as MEAC president of the Council of Presidents right now, you've seen the defection of 4 big programs from the league. And, I'm a MEAC guy, so Hampton leaves, A&T leaves, you're like, okay, body blows, but you'll take it and move forward. Yeah. Losing FAMU and Bethune was really a gut punch for all of us who love and grew up. So you lost 4 teams. Those are 3 of the teams are really big football playing schools. You're down to 6 schools. So my question is, what impact will this have on the conference futures? How do you see it in the role that you're in right now?
Yeah, it is a difficult moment for the conference, but I think it also presents some opportunities. Some of those institutions were traveling quite a distance. Student athletes probably were not getting the best of care given the fact that they were missing classes and things of that nature. And so I think we have to rethink the configuration of the conference, obviously, and who new members should be, what they should look like. We're well into that process. And I think, we're going to do a good job as a group in terms of adding the right types of institutions that would keep our academic standards high, but at the same time, have us extremely competitive.
So there is a thought that the Conference A is still attractive to other schools looking in. Have you had other people looking to fill the places that have been left by the voids from that quartet of teams who are no longer with us?
Yeah, I think it's very attractive. I think people look at what we're doing and they see that the conference as a whole is made up of fantastic schools with very good research activity, strong academic activity. These are student athletes, and so that must play a role. And they also see institutions that are investing in their athletic programs to ensure that they could be competitive. So we do think that we'll be able to attract the right types of institutions to join us.
So is there a redemption song, if you will, in the works for the MEAC?
Yeah, I think it's going to be more than a redemption song. We're going to give it the best effort. We're going to take a deep breath, fill our lungs, and see if we can get the vocal cords to work as well as they can. We are going to take good care of our student athletes, and we'll navigate this moment come what may, but we will make sure we navigate it well and do the right thing by our student athletes.
And I saw the documentary, so that would be a heck of a job by the conference if they do what you guys did back in the 70s. So what are the real prospects for spring tackle football and, the fall sports competing? I understand everybody's heart's in the right place, but you got to figure budgets, logistics, what'll be available in terms of how do you coordinate if you got a field hockey game and there might have been a football game scheduled. What's that dynamic like from the perch where you sit?
That's going to be difficult, I have to be honest, because there are lots of logistics around that may not work. And I think even if the country is in a better place with respect to the pandemic, increasing the amount of things that we have to account for by having fall sports in the spring is not going to be easy. That's going to put added pressure on. It is something we're going to look at without a doubt as a conference, but it is going to be very difficult to pull off. And so I also want to be pragmatic and realistic about what that is possibly going to mean.
And how does football fit in, particularly at a school like Howard, a private institution, relative to overall operating budget for the athletic program? If you don't get to play those big money payday games like the University of Maryland last year, how does that affect the bottom line?
Yeah, it definitely affects the bottom line negatively. But as I tell people, we invest millions of dollars in scholarships for student athletes, and we have a graduation rate about 80% of our athletes graduate. So, I think it's a worthwhile investment in those young men and women. And I think we have to start looking at kind of what that bottom line looks like from a different perspective. They go on to have great careers and do great things in the society. And I think we have to start paying more attention to that outcome, or as much attention to that outcome as to how many of them go pro.
Now, recently, there's been this phenomenon of blue chip major prospects certainly acknowledging that they would be interested in playing at HBCUs. Where do you think this has come from? And are we looking at a seismic shift here? Do you get the sense that realistically, or this is something that we'll see, or are we looking at something that is sort of spinning off of the Black Lives Matter movement, and as it may die down, so might the interest in blue chip big time prospects wanting to play at Black colleges?
Yeah, I think it's something that's been brewing for a while, and I think the young people involved now are very committed. They're very altruistic. They're very thoughtful about what they want to do. They know a lot more about the world around them than we did when we were their age. And I think that has informed them that they want to make certain decisions that are going to put them in a place where they can do what is in their heart and follow their conscience. And I think that what you're going to see is real, in these young people. And as I meet some of them, I'm very impressed at their convictions and at their courage.
I'll let you go on this one, Dr. Frederick. It's often been said that when the real world or major colleges get the flu, that HBCUs have a pandemic. So the world is hopefully facing a once-in-a-lifetime challenge like we're facing right now. So how will, at the end of this, Black colleges fare in the long run?
Yeah, I think that saying is true, but the other thing I would say about that is that also has taught us resilience. And I think that resilience that it has taught us is what will allow us to thrive. And I think collectively, if we continue to be supportive of one another, we continue to work collaboratively, and we continue to rally our alum around the cause, I think we will be just fine. And I have to admit that so far, at the front end of this clarion call, people have been responding, and we just need to continue to see that. And we continue to welcome that support. And I think if that continues, we will be fine.
Can't wait to get back on campus. Can't wait to get to the Burr. Can't wait to call some games, and can't wait to talk to you again, Dr. Frederick. Thank you much for your time today.
Sure, my pleasure. You stay safe and healthy. Thanks.
You too. It's all about proper social distancing, washing those hands, and making sure you got your mask on. And I'll make sure I'll do that henceforth until the next time we meet, my friend.
Okay.
Thank you so much. That's Dr. Wayne Frederick, the president of Howard University and the president of the MEAC Council of Presidents. My name is Mark Gray. That's Mark with a K, Gray with an A. Thank you for joining us on this edition of The Gray Area. Remember, you can find me all over the place in cyberspace at The Sports Groove 24/7, 365 on a computer, smartphone, tablet, no matter where you get your social media groove on. And remember, it's up to you to save lives. Mask on, wash up, give somebody else you love a hug tonight. You may not get a chance to do it tomorrow. Till next time. Go in peace.